Dr. Jaffe, there has been recent research, and in particular, this is an article that piques interest. It's a couple of years old, from 2018, but in cancer epidemiology, to talk about high vitamin B12 status and a cause of lung cancer. People have been going back and forth about it, but um, how would you comment on this, given that we know the benefits of high amounts of hydroxycobalamin and what it does to the body? Would love to hear your thoughts.
Well, first and foremost, all B12 is not the same. Second, what does it mean when the B12 level is elevated? Most of the time, the reference range is for deficiency. If you want to have sufficient B12, you will have elevated B12 according to the laboratory. That is a good thing if it's hydroxycobalamin. Now, with regard to the risk of elevated B12 and cancer, I'm going to go back further to a study that was widely reported and misunderstood. And this study showed that if you had beta carotene and B12, that this did not prevent lung cancer in Finnish smokers, people from Finland. Some of us looked at that and we said, oh, what this really says is that isolated forms in excess are not recommended. So beta carotene rather than carotenoids. We recommend the full carotenoid family. We do not recommend beta carotene alone. Similarly, if B12 is elevated because B12 is not being used because B12 is part of the B complex family, and if the family, the complex of Bs, balanced Bs, is not sufficient, then B12 will not be metabolized. So on the one hand, we want B12 to be increased in healthy people using nature's B12 in combination with other B components. And this applies across the board. The isolated single form in isolation is imbalanced. It's a kind of pharmacology that I don't practice. We want to have enough B complex, enough ascorbate, enough carotenoids, enough omega-3 fatty acids to keep us in balance. And then you find that there are some people who have elevated B12 because they're only taking B12 and they're not taking the B complex. And then you find people who have elevated B12 because it should be elevated to be physiologic, to be helpful. So be careful of measuring one thing, and especially because in the study that were the more recent study, people were taking cyanocobalamin. We never recommend cyanocobalamin. Why was cyanocobalamin invented? It was invented in the 1930s, I think, because at the time, B12 was unstable and the cyanide stabilized the molecule. Well, if you're taking a few micrograms a day of cyanocobalamin, that's okay. But if you're taking as much B12 as I recommend, and it's the cyano form rather than the hydroxyl form, that's not recommended. So think about the B complex, think about the way in which B12 is used and know that the laboratory is looking for deficiency of B12, not sufficiency, and that the sufficient range is many times higher, much higher than would be observed if you reference the lab range. So what should the B12 level be? It should be very high. It's not, it varies considerably from day to day. So any one measurement is not sufficient of itself. But we look for a B12 level that is typically 10 times what the lab range upper level should be. Can you take too much B12? Not that anyone has ever found. If you're taking hydroxycobalamin, however much you're taking, if you take more than you need, it'll be excreted in urine, sweat, and stool. It's water soluble. It's absolutely regulated by the kidneys, by the stool, by the sweat. And yes, if you have chronic kidney disease, that needs to be attended to. But most of the time, when you have an elevated B12, it's because people are taking just B12 and not enough B complex, or because they're taking the wrong form of B12.